Hi, I'm ARON, a responder with Hatzolah, with a message for your well-being this summer. Ensure that you drink lots of water, and especially the elderly should drink water throughout the day.
In a medical emergency, call Hatzolah on 9527 5111. We can call an ambulance if needed. As a call taker, I may ask you the following questions, so please have this information ready. First of all, what's your phone number? Second of all, where's the location of the emergency? Next, what happened? And lastly, some information about the patient themselves. How old are they? Are they conscious, awake and talking? Once our responders arrive, they may need to ask you for some further detailed information. Remember, keep Hatzolah's phone number handy and teach your children to recognise the green stickers in case they ever need to ask for help.
Pool safety is very important. Always supervise children swimming and make sure that you yourself know how to do CPR and how to rescue someone in case of emergencies. If you can't do that yourself, have somebody available who can.
I'm going to take you through what to do if you come across two of the most life-threatening and time-critical medical emergencies. We're going to follow a process called the primary survey. It's made up of an acronym called Doctors ABCD, where the D stands for checking for dangers. So you're going to check for dangers first for yourself, then dangers to everyone else around, and finally dangers to the patient on the floor. Response, you're going to talk and touch to see if the patient is responsive. If they're not responsive, we're going to send for help by calling Hatzolah. Then we're going to manage their airway. So that's A, we're going to have a look in their mouth to see if it's clear. If not, we're going to put them on the side and clear the airway out. If the airway is clear, we then tilt the head back to open the airway up, after which we can go to B, which is checking for normal breathing. We're going to look, listen, feel for 10 seconds to see if we're hearing 3 normal breaths in an adult. If we do hear 3 normal breaths, we're going to roll the patient over into the recovery position, in which case their airway is protected. If they're not breathing normally, we're going to start CPR, which is made up of 30 compressions and 2 breaths. We're going to do compressions at a rate of approximately 100 per minute, pressing down about 1/3 of the chest height. We are the first link in what's called the chain of survival, which is early access, early CPR, early defib, and advanced medical care. It's imperative that we start CPR as soon as possible, even if you've called Hatzolah. Every minute that CPR defib is delayed is a 10% less chance of survival for your patient.
If you own or buying your own home, it's your responsibility to make sure you have a working smoke alarm. If you are renting, it's your landlord's responsibility. Other safety equipment that you can install in your kitchen would be a fire extinguisher and a fire blanket. The fire extinguisher needs to be one such as this. It has that white band. It means that it's filled with a dry powder, and that is the most appropriate for house fires we typically find in the domestic home. Also, a fire blanket. They're cheap insurance for your family's safety. We have a saying in the fire brigade, look before you cook. Before you use your barbecue, make sure that you check for leaks. There's too many people still being injured from poorly maintained barbecues. You can use soapy water around all the connections on the gas bottle and the barbecue itself, and that will show if there's any gas leaks.
One of the first things to remember is weather's getting warmer. And one thing to do is never leave a young child alone in a vehicle for any amount of time at all, not even a few seconds. Another message I really want to get across is to not text and drive. Don't text and drive. Some accidents are unavoidable, and we go to a number of car accidents as first responders, but some accidents are avoidable, and texting while driving is one of those. Talking about driving and safety on the road, if you've got young kids that use scooters or bicycles, always wear a helmet, no exceptions. Same applies to adults. We all love the summer weather, but overexposing ourselves to the sun can be really dangerous. What are some of the danger signs? Nausea and vomiting, headache, a change in behavior, and a flushed skin. And if you're concerned, call Hatzolah for help. 9527 5111. That's 9527 5111. Chanukah revolves around oils. Heating oils, donuts, latkes. If you do burn yourself with oil, it can be a rather severe burn. The way we treat it is to run the area under cool water for at least 15 minutes, and that applies to any kind of burn.
If we all play our part and take a proactive approach in our own safety, it will be much easier to achieve a safer and more resilient community.
On behalf of all of us at Hatzolah, I want to wish you a happy Chanukah. Be safe. Remember, we're available 24/7. It's 24 hours a day, 7 days of the week, every day of the year. Just call us 9527 5111.